Another thing that we hear from patients so often is, how do you form that relationship with your healthcare team, or how do you communicate most effectively? I don't know if you have any words, again, words of wisdom. Or,
yeah.
I know a lot of times it's really being very open and honest with your team and saying if you don't understand something, or can you explain this a little bit differently?
There's a lot of great doctors, but don't really have the best bedside manner.
Right.
So it's hard to find that combination. I love my oncologist. He's got both.
That's wonderful.
Very knowledgeable, but he's very, empathetic and is very calming to me, because he'll always say, "How you feeling?" I'm like, "You tell me. How should I be feeling?"
Right.
Keeping an open dialogue is important. I have friends who their doctors recommend chemo, but they want to try alternative methods, and they're doing that. And not all doctors agree with that, but you have to do what's best for you. You feel is best for you.
Right.
Nowadays it's easier also to communicate with doctors if they have, if they're open to it, with email, or if they're good about calling you back. But email's huge because they can respond when they get a chance. Sometimes you get that much quicker than a phone call.
Absolutely. By the time you wait for the call.
So technology has definitely helped with that communication as well.
Right. And when you go to your appointments, do you take someone with you? Does your husband
yeah, always.
go? Yeah.
My mom, my dad, my husband, whoever can come. Typically my mom, because she's retired.
Right.
Yeah.
We always say that's just so important.
Yeah.
Because it's hard to hear, and you need that extra set of ears.
Yeah.
And
she's my note taker. Yeah.
Yeah. I always say that's so important.
It
Definitely.
Is.
I know you have more than one caregiver. You know what I mean?
I do. True.
Which is lovely. Once you kind of leave your appointments, do you always kind of talk through things? Like, do you make your decisions kind of together, would you say?
Yeah, but I think my family, my parents and my husband respect ultimately my decision on what I choose to do. They support whatever route I go, but their feedback and input, opinion, whatever, is very important to me. I take that into consideration for sure.
Right. Because sometimes we hear that, that's a difficult situation if the patient and caregiver don't agree.
Right.
And I don't know if you've learned anything maybe on your Facebook group that you started or things. I know I've read on some, forums and in support groups. That's a difficult thing because the last thing you need is conflict when you're fighting a disease, especially with your loved one.
Yeah.
And I'm thankfully that's not your situation.
I'm very thankful.
Absolutely. Yeah. Have you heard about that from other individuals, or?
Not that not off the top of my head, but I know it's out there.
Right.
Who might have spouses who aren't necessarily supportive, but not necessarily when it comes to their choices of treatment.
Right.
I'm sure it's out there though.
Right.
Yeah.
And that's another thing too, when you hear this, that like you said, spouses are sometimes shy away.
Yeah.
Or friends pull back because they just don't know what to say, and it makes it tough.
A lot of people are afraid of saying the wrong thing.
Right.
And there are people who do say the wrong things.
Absolutely.
Through the last 3 years, I've definitely cut people slack because I can't expect anybody to know exactly what to say unless they've been in my shoes.
Right.
So how can I, if you say something that might not be so great, well, I want to rephrase that or say it differently.
Right. I think people have the best intentions.
Yeah.
But sometimes they just.
Sometimes you got to remind yourself that because it's a little hard.
Yes, absolutely.